Hi, my name is Blessing, and I recently completed my master's in health education and wellness coaching at the University of Utah. Today, I'll be giving a brief description of my poster, which was based off of my project for my program. And the title was Cultivating Culturally-Based Wellness, which was an experiential diabetes prevention program with refugees. Refugees are termed a vulnerable population due to lack of access to healthcare services that they faced when they moved from their country to the United States. They're at risk for both communicable and non-communicable diseases. About 46% of the mortality in refugees is largely due to non-communicable diseases. Refugees also have an increased risk of developing diabetes compared to people of the same age and gender as they are, and people living in the same community. Therefore, there is a need for us to pay attention to reducing the burden of diabetes within the refugee population. One of the lifestyle management strategies that has been implemented over time and has shown great success is the Diabetes Prevention Program. This is a 1 year long program that typically focuses on lifestyle changes in the bid to prevent diabetes. The National Diabetes Prevention Program has not been delivered to the refugee population. And because this program is very rigid, because it has only been given or delivered to Native Americans, it is very important to understand the needs of refugees and appropriately tailor this program to meet the needs of the refugees. Therefore, the purpose of my program was to create an experiential, culturally adapted diabetes prevention program for Thrive, which was the company that I partnered with, geared towards increasing the self-efficacy of refugees to preventing diabetes. The self-efficacy here is the confidence of the refugees to prevent diabetes. How did I go ahead to do this? Every Monday, starting from October through December of 2024, we add a 2 hour session. This program ran for 7 weeks and was offered in person at the Thrive office. We had four female refugees, two Congolese and two Sudanese. The session started with a check-in and ended with goal setting at the end. What did we do in all the different weeks? The first week, there was an introduction to diabetes, so a lot of education. On the second week, we talked about getting active. And at the end of the class, we did a physical activity movement together as a group. On the third week, we talked about eating well to prevent diabetes. After the class, we had a cooking class, and there we made boiled plantains and spinach soup. On week 4, we talked about managing stress. After the class, we talked about some strategies to manage stress. And as a group, we decided to practice some dancing and singing to manage stress. And all the participants really liked that. On the 5th week, we talked about getting more active. So doing more than what you're doing presently. After the class, we talked about how to use resistance bands. And as a group, we used resistance bands and I showed them how to appropriately use that. On the 6th week, we talked about eating to support your goals. In this class, we talked about healthier ways to cook and all the different ways to cook and what the healthiest way is. After the class, we had a cooking session, and here we made fries with egg frittatas. The last week, which was week 7, there was a wrap up. And so we wrapped up everything we were talking about, answered questions, and then the post survey was shared in this session. What were the results that we saw? Generally, there was an increase in the mean self-efficacy of the participants. Cross-board, we can see that stress management had the highest increase, followed by physical activity and then healthy eating. When we assess the satisfaction of the participants, 100% of the participants mentioned that they felt more equipped to change their lifestyle because of the things that they learned in the program. And when we asked the question if they will recommend this program to their friend, 3 out of 4 of the participants strongly agreed with that statement, while one participant agreed to that statement. From this result, it is evident that an experiential theory-based program is definitely effective in improving the self-efficacy in adopting lifestyle changes geared towards diabetes prevention. The participants mentioned that they felt much more confident in incorporating physical activity into their lifestyle and also eating healthy because of the things that they've learned in the program. Participants mentioned that they've gained skills that would help them to live a healthy lifestyle. Therefore, I will recommend that this project or this program be done on a larger scale so as to reach refugees and reach more of the refugee population and reduce the burden of chronic diseases among the refugee population. Thank you.